Welcome back. It's sad to say, but summer is now in its final month. But that means protecting yourself from skin cancer should still be a top priority. Detection has come a long way, and a new non-invasive technology is making it possible to be diagnosed right in the doctor's office and avoid uncomfortable biopsies. Here to tell us how it works is Dr. Babar, a dermatopathologist. He's also an associate clinical professor at Robert Wood Johnson and the owner of the American Skin and Cancer Center in Atlantic Highlands. Welcome to the program.
Thank you. Good morning.
So you are a dermatologist and a dermatopathologist, is that right?
Yes. Yes.
We know what a dermatologist is.
Yes.
What is a dermatopathologist?
So a dermatopathologist is a skin pathologist and who looks skin biopsies under the microscope and diagnose and analyze them for being cancer or not cancer.
Because typically what happens is that dermatologists will do a biopsy, they send it off to a pathologist to get it analyzed, but you just do everything at one time. Is that right?
Yes. So in many of those cases, if as a dermatopathologist, you still have to prepare the tissue, which takes at least a day, but I could read my own cases and sign them.
Now, as I mentioned in the introduction, summer's winding down. Kids are going to be going back to school soon. Why is it still so critical to be aware of the sun and use the sun protection and things like that?
Yes. So although in summer the sun intensity is stronger than non-summer months, but it is important to use sunscreen throughout the year, even when you are not at the beach, because those sun rays can still affect you, and if continuous exposure will predispose you to skin cancers and precancers.
How often should people get their regular skin checkups? Is there a number on that?
For most of the individuals, once a year skin examination is sufficient by a doctor. But for many of them who have a history of skin cancer or the family history of many moles or personal history of many moles, they may need twice a year.
Traditionally, skin, when we have something on our skin, we typically do a biopsy. Is that right? Is that the traditional way?
Yes, that's the traditional way. Yes.
And what's different today and what's new today? And we've actually got some video that we'd like to show, and maybe you can talk to us about this.
Yes. So traditionally, yes, we do a skin biopsy. Then pathologist looks at it usually after a day or so, and then makes the diagnosis. But nowadays, nowadays there are newer technologies, which we call them non-invasive technologies.
And this is called a vivoscope?
The one particular one we are mentioning is called vivoscope, where basically it's a non-invasive laser light, which is FDA cleared. You put a little ring on the skin surface, which being demonstrated right now by the technician.
Okay.
And then you will place this scope head on the ring, and it's looking through a mole, and these images then will be captured on a monitor, and you can make your preliminary diagnosis right then and there.
Wow. So this is not something obviously that hurts, and that's what she's doing. She's placing that right on that area right now?
Yes.
All right.
So it's not painful, non-invasive, no numbing involved, and no scarring afterwards, and you can make the preliminary diagnosis very quickly.
Very good.
Yeah.
Now, are there people who still need to have the regular skin biopsies?
Yes. In many cases, there are limitations to this technology if the lesion is at a
What are these images? I'm sorry. What are
these are the images we're looking at, which were acquired by this technology, and we can, if you are experienced in it, you can tell a bad cell from a good cell. Here we're seeing superficial layers of skin showing some normal cells.
So you were saying there's still a need for some biopsies, correct?
Yes, there will be a need because there are many cases where the lesion is too thick or located at a difficult site where you cannot place this scope. So there is still a need in many.
Do you foresee the day that biopsies will not be necessary anymore?
No, biopsies will always be necessary. However, the day is there already where before you do the biopsy, you can go through these non-invasive techniques, especially in patients if they have many moles, you cannot biopsy all of them, or patients who have a mole at a difficult site, such as a face or chest or hand. or a child who doesn't want a biopsy. So it's good to use this before the biopsy if needed.
We've got a couple of seconds left.
Yes.
Very quickly, SPF, what does it mean? What's the best number that we have to have? 20 seconds.
SPF, basically, the higher you use, the better you are. So SPF 30 and above, with a it usually covers against just ultraviolet B, but it's good to use a broad spectrum cream, which covers both UVB and UVA.
UVA and the UVB. Thank you for joining us.
Thank you.
Pleasure to have you here with us today. If you have any questions about anything you've seen on the show today, email them to us at 12toyourhealth@news12.com. Thanks for watching 12 to Your Health. And until next time, I'm Dr. Derek De Silva, and may you always be blessed with good health.